Hello, everyone. Thank you for joining us. Thank you for logging in. My name is Alex Mesheko, your host at Pharmacist Corner. We had some previous edition where we discussed about asthma, about hypertension, about ulcer. You need to log in, watch the series, share with friends, subscribe, and let's get this information across to people. We are just trying to discuss issues that are necessary for us to know how to live maximum health with no challenges, with the grace of God carrying us through after we have done our own side of the bargain. Now today we are talking about oral care. Oral care is important, though many a time we don't take it seriously because we say the mouth is not to just brush, eat and all that. It's a whole world of its own. The mouth is the gateway to the body, and that's why you have some doctors that specializes in that area, which we call the dental doctors. So if it's not important, we don't have people that will specialize in that area, in that field, of medicine. And even when you have the doctors, you have them specializing in different area of oral care. I mean, we have specialists in almost more than 10 specialists that take care of the oral care in general. And so it's important we pay attention to our health in totality. Now, how do we take care of our mouth, of our teeth? First of all, we need to learn the habit of brushing twice a day. The first one is after breakfast. The idea is that you should eat first and then you brush your teeth so that you can maintain some level of freshness for a long part of the day. Then when you return back home after dinner, before you go to bed, you brush the second time and then you are good. When you wake up, you just need to rinse your mouth, then you take your breakfast again and brush in the morning. So twice daily, that's what is recommended. In between, we may need to use the mouthwash, yes, cosmetic mouthwash, but not medicinal. Medicinal should be recommended. Talking about medicinal mouthwash, we don't need to use that regularly, but for the cosmetic one, yes, to just keep some freshness in between, maybe during the work hour, or if you are going for a social function, that may be necessary. Fine. When that is done, another important thing that a lot of people don't do is scaling and polishing. Scaling and polishing is very important. It's recommended that we do that every 6 months. Scaling and polishing. There are some things your brush, however hard it is, cannot remove some things, some scales, some things in the teeth. It is during the scaling and polishing that will be done by the dental nurse or the dental assistant that will take care of that. And in the process of doing that, if there's any issue coming up in any part of the teeth or in any part of the tooth, they will recognize it and then, call your attention to it, call the doctor attention to it, and then to take care of it. So it's important you do your S&P, scaling and polishing, every 6 months. Then another thing that is necessary for you to do is to visit your dental doctor at least once in a year. It's important we do that too. And again, to know the right toothpaste to use. All the toothpaste that you use either in the morning or in the evening to brush must contain fluoride. If your toothpaste does not contain fluoride, please, it is time to discard it. It may be called one herbal stuff or the other. Any herbal toothpaste, any toothpaste you use that does not contain fluoride, you should discard it. That is what is recommended by the experts, the dentists. All toothpaste must contain fluoride. And again, if you have any kind of like tooth sensitivity, if you drink cold water and you feel shock in the mouth, you need another special kind of toothpaste, which you can take care of tooth sensitivity. Is there in the supermarket, is available in the pharmacy. Walk up to your pharmacist, talk to your doctor, they will recommend the appropriate one. These are necessary things that we need to do to take care of our teeth. One important thing I need to mention is that when you have toothache, it's important you investigate the cause of the toothache. Don't just take analgesic and wish it away. Yes, you get relief, but most of the time it comes back. So you need to know the cause of that toothache. It may just be an underlying infection that need to be taken care of. It may be that your teeth is getting carious already, or it's even getting decay. Now you need to see the dentist so that they will check it. It may just require the teeth to be refilled. I mean the tooth to be refilled, and if it's more than one, they refill it. And you know, you have temporary filling, permanent filling. I mean, you can refill your teeth to the point that you don't even need to remove it, because I know a lot of people, why they don't want to go to the dentist is that they will remove my teeth, they will remove my tooth and all of that. No, they are professional. They will let you know either you need to refill or you need to remove when it's become necessary. But whatever it is, they will do the right thing, believe them, and then make sure you take care of your teeth, because when things goes wrong orally, it can really be bad. It can affect other part of the body. It can go systemic sometimes, you know. So let's avoid complications from oral care by not doing the right thing. If you do all of these things that I mentioned, believe you me, you'll be fine. You will not have a cost to even remove any tooth at all. So thank you, ladies and gentlemen. Thank you for your time. I hope this short one has been educating. You know, please share my video, like my page, subscribe, and let's get this information out so that we are doing the right thing every time. Thank you.